Well, in my view, leadership is about accomplishing goals, outcomes, improving healthcare, but through other people. So your effectiveness as a leader is your effectiveness to work with other people, everyone, and how you do that, how effective you are in leading is all built on those with whom are your friends and your colleagues and your partners and whatnot. So leadership is about getting it done, but through others. You're ultimately accountable. Goes right, goes wrong, you wear it, and you wear it and say, yes, I am fully responsible and accountable for that. I don't say no to anything right away. Let me listen, let me think about it, because you don't want someone else to feel rejected or the idea didn't count, even if it's crazy. Fundamentally, as a leader, having clarity of goal, clarity of vision, listening, really listening. Listen more than you talk. We have 2 ears, 1 mouth. Listen, and you gotta flex. You cannot be rigid. The leader must walk the talk. So you can't just say, okay, this is where we're going and let everyone head off. It's really important to keep up a relationship, to be visible, but indeed it's about enabling others with you to get there and to believe that when ultimately you reach it, that it's a reward for everybody. No, we didn't do this alone and not one person did it. That as a team we did it, and we're proud that we are there. But I'm very blessed to have had opportunity present itself. And I've always had a motto, if there's a knock at the door, open it. You don't need to go through the door. But if there's a knock at the door, open it. So did I plan my career? No. I did not plan my career, but I knew I needed to keep learning. I knew I needed to keep being challenged. I get bored easily. So I knew I needed to keep going. So I repeatedly had knocks at the door that when I opened it, I did go through. So I think the first point I would make is the importance of networking. Networking. Get your network established, keep growing your network. You don't have to necessarily be right at the forefront of it, but participate, know who's out there. It can open doors for you, give you opportunities to speak. The other thing is to have a mentor, and I think we can all look back in our career. I can look back and identify 3 or 4 people who were very significant at that phase of my career that definitely influenced or supported me one way or another. The other piece is keep learning. Never, never stop. As I think we all have a responsibility to get a message out, whatever that is. So if you have a really great accomplishment in your unit, in your department, in your organization, you have a responsibility, I do, to share that at a conference, to publish, to get it out. Because I think we all can influence the future and we can all influence where we're moving, but we have a responsibility to get the word out. And I do a lot of speaking these days on quality improvement and why is it taking us so long to feel that healthcare is safer. And I think all of us have to look in the mirror. If we think healthcare is not getting safer or not getting safer fast enough, we need to look in the mirror. You know, what can we as leaders do differently? How do we need to enhance our leadership and what we are doing to really get that scale spread and sustainability? The whole health system must be transformed. We are still focused on sectors, whether that's long-term care, acute care, rehab, whatever, and we're still focused on specialties. You've got to shift this, that the focus is on the person. The focus is on the client, the focus is on the resident, and how does the system work around that individual? And we are not there. And until we can transform the system where truly the person, the individual, is that for whom we are building the system, we've got to break down those sectors. And until we really take this by the horns and transform, take a region, take an area and say, we're shifting this whole thing, including funding and everything else. It's, you know, hopefully in our lifetime we'll start to see some of this. If you care for the staff and care for the people who are there to directly, indirectly provide the care, they will in turn provide quality care to those who are the recipients of the care. So the quality of the working environment has always been a big priority of mine, and for staff to know you're there for them.